As you all are aware, last Monday we announced our first 2 confirmed cases in Georgia involving residents of Fulton County. We now have 6 confirmed cases of COVID-19 here in our state. There are 3 confirmed cases in Fulton County, with the first 2 cases involving 2 family members where the parent had recently traveled to Italy. Both are isolated at home with mild symptoms. The 3rd case in Fulton involves an individual who is currently hospitalized. The source of the infection is unknown at this time. 1 patient in Floyd County was confirmed earlier today to have COVID-19. This testing was done by LabCorp. The patient remains hospitalized and the source of infection is unknown at this time. 1 patient in Cobb County was confirmed to have COVID-19 on March the 7th. Testing was conducted by the CDC. This individual also recently traveled to Italy and is isolating at home with mild symptoms. A patient in Polk County was confirmed to have COVID-19 on March 7th. Initial testing was conducted by the state lab and confirmed by the CDC. This patient remains hospitalized. The source of the infection is unknown. We now have 7 presumptive positives pending confirmation. There are 2 in Cobb County, 1 in Cherokee County, 1 in Gwinnett County, and now 3 in Fulton County. Over the past few days, we've provided information on all of these cases except for 1, and I will go through that one now. Over the weekend, state health officials learned about a situation involving a South Korean individual now hospitalized in Fulton County. This person is exhibiting symptoms consistent with COVID-19, although testing results are still pending. It is unknown whether this individual was symptomatic when they boarded a flight from Incheon International Airport to Hartsville-Jackson. Upon arrival at the airport, customs officials noticed that the passenger was displaying symptoms. The passenger was transferred to the CDC quarantine unit for further evaluation. That unit is at the airport and was then later transferred to a hospital. Overnight, state and hospital officials were able to secure a translator and arrange for the patient's transfer to an isolation location for monitoring by state health officials and contact tracing. Earlier, I spoke with federal officials about this case. They are already working to evaluate the system and to determine potential exposure. We've been informed that CDC officials are prepared to answer questions regarding this specific case, and we have been assured that federal officials will continue to provide us with updates as they become available.